Hello, everyone, and welcome back to another episode of the Storytime Clinic. I am your host, Dr. Mfon Umar, and I'm a pediatrician and lover of children's books. Usually on our regular episodes, I am talking about a children's book featuring a character with a chronic health condition. But every once in a while, we will mix in an episode where we get to talk to someone else who is working with children with health conditions in one way or another. And this is one of those episodes today. So I'm really happy to welcome to the show Dr. Julia Lamotte. How are you doing, Julia?
I'm good. How are you?
I'm doing great. Dr. Julia is a pediatric psychologist, and she specializes in working with children, adolescents, and young adults with chronic medical conditions. She is passionate about supporting children as they live a fulfilling life with their illness. She received her doctorate of philosophy from the University of Georgia. She completed residency at Dell Children's Medical Center in Austin, Texas. Yay, Texas. I did my residency in Texas too. And then she did her fellowship at Children's Hospital of Philadelphia. So welcome once again to the show, Julia.
Thank you.
Yeah, we're really excited to have you join us today. And I'm always very curious to find out kind of how people got started in their field. So how did you end up as a pediatric psychologist? What got you interested in that?
Sure. So I've always enjoyed working with children. So kind of always knew that that was something I wanted to do. I had considered a career in the medical field. And often when children and families face chronic health conditions, we focus on the medical condition. And so when I learned that there was a career path that allowed me to kind of help work with the family broadly and the emotional impact of having a chronic health condition, it was kind of like that light bulb moment of that's what I want to do. So helping to work with the child and the family kind of from a holistic perspective.
That's really interesting. Now, when you were pursuing that career path, did you initially do psychology broadly and then you narrowed it down to working with children, or did you kind of start out saying, I know I want to work with kids definitely, and then I just need to kind of find my niche within that?
Yeah, it was definitely more the latter of I always knew I wanted to work with kids. I had thought about becoming a teacher and had pursued kind of a career path initially down that road. But then in between undergraduate and graduate school, I worked in research for a few years and worked with children who had gastroenterology or GI conditions. And so kind of knew I always wanted to work with kids and adolescents, but trying to figure out exactly what specific medical condition has kind of been the winds and where my career path has turned has been trying to figure out which condition.
Absolutely. Yeah, I understand that. And I really like what you said earlier, talking about how a lot of times our focus is just on the medical condition, especially as a physician. That's kind of what we are focusing on, treating the condition as best as we can, getting them back to good health. But a lot of health, is about the emotional and psychological aspect of things as well. So I know that you guys definitely play a very significant role in how children and their families deal with the process of illness. And why don't you talk a little bit about what you do to help kids and their families?
Sure. Well, I will say that no 2 days look alike for me. So I am embedded in our comprehensive sickle cell program. So 1 day a week, I get to meet with families from the time of diagnosis at birth or just shortly after birth, all the way from when our children transition to adult care. So I get to work with families across the developmental spectrum, mainly providing some more so like brief interventions, so some brief like emotion coping and things of that nature. I have a very small kind of more traditional therapy caseload So whatever you're thinking of when you think of therapy, that's probably similar to what I do.
Okay.
And then I also work with families when they are in the hospital as well.
Okay.
So depending on what the family's needs are for the week will depend on where I physically am in the hospital.
I see. Yes, and so a lot of the work that you do, as we talked earlier, is on helping children and their families with sickle cell disease. And we are recording this episode in advance of World Sickle Cell Awareness Day, which is June 19th. And for anyone who's listening and is not familiar, sickle cell disease is a blood disorder. It's inherited, so it's usually genetic, passed down from parents to their kids. And in this disease, the shape of the red blood cells is a little bit different. It's shaped more like a C shape or like a banana shape, and sometimes this makes it hard for the cells to pass through blood vessels. They can kind of get stuck there, and they can cause issues with pain and can over time cause damage to the tissues and the organs. And so a lot of times we have kids who might be ending up in the hospital with pain crises, and so they might be there managing their pain for a period of time. You also mentioned that you're working with families kind of across the spectrum of childhood. And in the US, we have newborn screening that picks up this disease pretty early on. So we are testing within the first week of life usually. And if we have a suspicion that the child has sickle cell disease based on that test, you can do more testing there. So in those early days, you would be kind of talking with families really, and kind of helping them through this new diagnosis. So tell us a little bit about what that might be like.
Yeah, so it's actually the most commonly identified disease on newborn screening, but many people don't know that. So when a family comes to our clinic for the first time, a lot of my role is just checking in with how parents are coping with this information. Because for a lot of families, they've had a few days to process it, but they're now starting to think about the life that they thought their child was going to have, and now it might look a little bit different. It's also working with parents of new babies, and so wanting to check in on parents' mental health is super important, at least initially.
Absolutely. Yeah, it's a time that there's a lot of changes going on and a lot of adjusting anyway, in that time. And so on top of that, you're putting in a new diagnosis. And so there's that aspect of uncertainty, I guess you would say. So
Absolutely.
I can imagine how that would be difficult. Yeah. And then as you're going on, as the patient gets older, how are your goals changing, and how are you catering that to meet where the child is developmentally?
Yeah. There are a few domains or few areas that I'm constantly looking out for, kind of regardless of the child's age. Now, what I'm looking for might look a little different depending on the child's age, but for example, one of the things that I'm constantly asking about is sleep.
So interesting. I would not have imagined that.
Yeah. So we know that sleep quality and sleep quantity can affect things like emotion regulation, so your ability to experience emotions and then respond to them internally, kind of within your external environment. And just it plays a crucial role in a lot of things, including learning and being present in school and attention. And so from our itty bitty babies to our adolescents, I'm always asking about sleep. Now, of course, that's going to shift. And so our adolescents, I don't get shocked when they tell me that they're going to bed at 1, 2, 3 in the morning.
Naturally.
Right, that shift happens. But as long as they're getting sleep is my primary concern. I often will ask about different aspects of attention, or what we would call executive functioning. And the reason that I do that is because we know that children with sickle cell disease are just at a higher risk of impact on their executive functioning skills, and that just has to do with the part of the brain that's most susceptible to injury or insult. And so I'm constantly making sure that our kids are kind of on track there. And if they're not, we can provide them with some interventions.
Yeah. Those are all very important issues, and it's always so nice to have to speak with someone who's kind of trained in a different way, in a different aspect. Because when I think about kids with sickle cell, I'm thinking about a lot of things like, are they taking their medication? What are their how often are they having pain crises? Things like that. And so it's helpful to have someone who can have a bit of a different perspective and kind of focus on things like how their overall quality of life is, and what are the things that we can do to enhance those different areas. So how are they doing in school? Sleep is going to affect how they do in school. If they are if they're not having small amounts of damage over time that are causing problems with executive functioning and all that, that's also going to affect things like how they make decisions and how they behave and how they interact with other kids. And so that social aspect, so all of that is really crucial. And it's nice to see that other services are supporting those areas.
Yeah. And that
For
just
sure.
as you're saying, like, executive functioning ties very nicely into adherence or being able to take your medications. So trying to figure out, is it that you don't like the taste of the medication? Is it that you don't want to be taken outside the classroom? Is it that you're taking medications in the morning and the morning is just so busy that you forget to do it? Or what we more commonly see in adolescents is just that they've been doing this for 15 years and they just don't want to do it anymore.
They're tired.
So, yeah, exactly. And so the intervention looks differently depending on kind of what the concern is.
Yeah. And I'm glad you mentioned that, because adolescence is that stage of life where I think we particularly find a lot of difficulty, obviously not just with sickle cell, but with a lot of chronic health conditions. Like you mentioned, they've been doing this for a long time. When they're younger, they maybe have a little bit less of a say because their parents are, making them take the medications. And when they get to adulthood, they are at the point where they should start taking responsibility for those things themselves. But sometimes they may not fully appreciate the importance of why they're having to do that. And so I think that transition period, that adolescence, can be very difficult, and can kind of, what we do here can kind of set the stage for how they continue to take care of themselves as they become adults. So how do you work with kids who are at that point where they are not taking responsibility and they're not interested in taking the medications, and they're kind of, checked out in a way from taking those steps that they need to take to keep themselves healthy? How do you get them back in the game?
Yeah. So it definitely depends on how the family is dividing responsibilities. And so it's working with the family unit as opposed to singling one person out. And trying to figure out what the child or adolescent may be motivated to, which aspect of their care are they most motivated to kind of take ownership of. And usually if you ask them kind of what they're already thinking about, they usually have a good sense. And so we know that it's much more effective to work with the child or work with the teen in what they're already thinking about. So maybe they've thought about, okay, so I don't want to take this, but if I have to take this, I'd rather take it at night, or I'd rather take it in the morning. So working with them and working with what they've already been thinking about. Kids are smart. And so they have good ideas. And I think they're all, a lot of the families they have the privilege of working with are also very creative. And so they think of things that I may not have ever even thought of, and going with their ideas. And then maybe we're honing it in or problem solving what might get in the way of making whatever their plan is happen. But I try really hard not to impose any of my own beliefs and more so focus on what they've already kind of thought of, and then work through some of the potential barriers.
Okay. Yeah. So it sounds like almost giving them a sense of control in a way. Like I can choose how I'm going to do this. And that might
Absolutely.
sometimes help with adherence. Yeah,
Yeah.
yeah, I agree with that.
Yeah.
Completely.
I mean, it's true with our little ones, like our 3 to 5 year olds, control and making choices and having them have a choice. We know that's true, for example, when they have to get vaccinations or shots, you want to give
Mhm.
choices, right? Do you want it in your left arm or
Mhm.
your right arm?
Mhm.
But the same is true with adolescents. They want a semblance of control, and we can do
Mhm.
that.
Mhm.
And that can make all the difference when it comes to success.
Yeah, yeah, absolutely. And what about those, I would say, I guess the effect of having difficult disease. So a lot of times with sickle cell, I know here we're talking about medications that we're wanting people to take. So one of the medicines, hydroxyurea, kind of helps to increase the amount of healthier red blood cells. And so this hopefully allows kids to have less issues with pain and less damage to their tissues over time. But sometimes children are still having a hard time. They're still having many pain crises for whatever reason. They end up in the hospital for long periods of time. So, two things there. I think both the uncomfortable experience, obviously, of being in a lot of pain for many days out of the year. And also the fact that when you're feeling like this, you're out of the usual activities, that everyone else is participating in. You may be taking time off of school. You may be missing family events. Generally, they don't have, again, that control of what they actually want to be doing in life. And instead, they are dealing with their illness. So, how do you kind of explore those kinds of issues with them?
Yeah. So again, when I'm working with a family while they're in the hospital, that obviously looks different than when
Mm-hmm.
they have been discharged. And a lot of what my role involves is validation. So, validating their experiences. For a lot of
Mm-hmm.
our children with sickle cell, when they interface with the medical system, they unfortunately often feel like they're not believed by the medical team. And
Mm-hmm.
so a
Mm-hmm.
lot of what
Mm-hmm.
I do is validate that, yes, I hear you, I see you, this pain is real,
Mm-hmm.
and let's find a way to get through this together. So, whether it's through distraction or other pain coping skills, that's one way that I can be involved. Sometimes, especially with our adolescents, working on acceptance. So
Mm-hmm.
knowing that, right? So if we resist the experience, it can be more painful, and there's a difference between pain and suffering. And again, that brings back in this aspect of control. So being able to kind of find yourself in the situation and what aspects can I accept that this is what's happening, but this is temporary and that this will
Mm-hmm.
pass.
Mm-hmm.
So it often depends on the developmental stage of the family that I'm working with. But
Mm-hmm.
you're absolutely right. Part of it is accepting the frustration around the things that they missed. And
Mm-hmm.
I can't, I mean, it's invalidating if I say, well, there will be another blah, 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 right?
Yeah.
That
Yeah.
doesn't matter. Like, okay, so you're missing graduation. Let's sit in that. That's hard.
Yeah. 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 I think that's so important. Just kind of what you said, validating and helping them accept what is happening without minimizing it. I think a lot of the times we might have good intentions and might want to just get them into a positive headspace. And so you say, look on the bright side, this is happening, that's happening. And then sometimes that might end up being more frustrating to them because they might say, you don't understand. You don't understand what I'm talking about at all. So I think that's a good reminder. To just, and sometimes it's uncomfortable. You want the person to be feeling better. You want to be able to help motivate them and everything. But sometimes the best thing you can do is just be there and kind of listen to the frustrations, and listen to give them a safe space to kind of share some of those feelings. So yeah, I think that's really helpful. Another thing that I am always curious about, a lot of the families that I work with in my job at the hospital, we have families that have kids with chronic health conditions, and you might hear their stories, and they've been through so much, but they have such a they've learned to cope with it in such a positive and a strong way. And so I'm always curious how we can help build resilience like that in other families. How do we help foster that sense of, um, at the same time, accepting that and understanding that there is an issue that's difficult to deal with, but not letting that sink into a depression or a very negative headspace for a long time? How do we allow them to experience what they're experiencing, but also be able to continue to make it through life? How do you build that resilience?
Yeah, that's such a good question. I think part of it is some of the things that we've already talked about, right? So identifying that your experiences have emotions that come along with them. And so when we pretend that you're not having an emotional reaction to something, then we're pretending like it doesn't exist. And so I think even just being able to identify, okay, I'm feeling really frustrated right now, or helping kids to experience and identify their emotions. And that way then they learn, okay, I felt this way before. Last time I took some deep breaths. Last time I did some progressive muscle relaxation. Last time I did this and it worked. And so then I start to learn, okay, I can take care of this. I can do this. I have the skills. I have the inner capabilities to manage this. And so the next time it becomes a little easier. But part of it is just kind of hearing their stories and hearing the narrative that they're creating, and how so many of our families just want to be heard.
Yeah, absolutely. And what about for the younger children, sometimes the ones that don't really have the words to express how they're feeling, or they don't really understand? Are there different things that you do that are not necessarily talk related, that can help a younger child kind of express their emotions around being sick or being in the hospital?
Yeah, especially for our really little ones, it's a lot of working with our parents, right? So our parents help to co-regulate emotions. So if mom is soothing baby or dad soothing baby, like you're helping them to realize, okay, you're having an emotion, and you can go to mom, you can go to dad, you can go to grandma to help you regulate, because that's really hard for our little ones.
Yeah, absolutely. Yeah, so I guess you're partially training the family to be there and be supportive, and be like a safe spot when those emotions are being expressed, and then through that the child is kind of learning that that's where they can kind of draw on some additional support and strength. That's interesting.
Yeah, absolutely. We learn how to express our emotions and how the world receives our emotions, with the home environment being the very first place that we're testing out those things. And so if we provide a supportive environment that says it's okay, to be sad, it's okay to cry, that gives us really important information about how we'll be received in the bigger world.
Yeah, I agree with that. Yeah. And we've been talking, I guess, about a lot of the more difficult aspects. So when people have difficult hospital stays, or the frustration, the anxieties, the difficult aspects. But what about times when we are supporting the positive things? A lot of people kind of come out of having a long time illness with a certain different perspective, and almost a strength, you would say. How do we kind of support that kind of identity?
Yeah. I have a lot of young adults who, because of their lived experiences, have chosen professions where they really want to help others. And I think that's a product of their lived experiences. So interfacing with the medical system. I have a few patients right now who are becoming phlebotomists, or who are going off to nursing school. That they really want to be the nurse or be the tech that they didn't have, someone who understands it,
Yeah. Yeah.
and who can really work with kids, which I think is really lovely. They're taking something that could have been negative, and they're growing from and with it and turning it into something really beautiful.
Yeah, yeah, I agree with that. We've had, some, I work at a transplant unit, so we've had some patients that used to be, that I guess went through the experience of having a transplant, and they're back like 10 or 15 years later, and they say, hey, I just started my rotation as a nurse. And so the ability to kind of come full circle and be able to give that support, and that understanding, like you're saying, a lot of times people in the medical field may not understand the exact experience that a patient might be going through. So just to be able to kind of give that additional like support and perspective, I think is such a positive thing, for the patients and for the people who they will be impacting, So I think that that's amazing.
Yeah.
Yeah. What are some of the challenges you would say that you have in your job and being able to do it well?
I think, unfortunately, two of the biggest challenges, are how patients with sickle cell are often perceived by different medical team members. So there's a long-standing history of patients with sickle cell not being understood by the medical team, or there being biases against patients with sickle cell. I think we have a lot of discussions around implicit bias that we need to continue to have conversations about, and how that directly impacts our patients with sickle cell. I think that's true both from the perspective of race, but also there are biases when it comes to mental health as well, or biases when it comes to pain how it's perceived. And so there's a lot of work that we need to do there. I think the second piece is, one of the biggest problems is funding. So there hasn't been enough funding to create the medical advances that we really need for our patients and families and what they deserve. There's a huge disparity when it comes to funding. So for example, we often compare or we'll look at how funding occurs for patients with sickle cell compared to, for example, cystic fibrosis. Cystic fibrosis occurs about 1/3 as commonly as sickle cell, but receives 3.5 times more funding when it comes to the NIH, the National Institute of Health. And when we look at external funding sources nationally, for example, cystic fibrosis receives 440 times more funding than sickle cell. And that just creates huge disparities when it comes to treatment, and access to treatment, and access to other identification of other kind of complications related to living with this disease, which is really unfortunate.
Yeah, absolutely. Yeah, that's a huge disparity,
Sure.
And I think that there's a lot of things that go into that, unfortunately. But I think one of the reasons why it's so important to have a day like this, World Sickle Cell Awareness Day, is that we get to talk about things like this and hopefully reach the right audiences, so that over time these things are changing, definitely. Do you have any favorite websites or things like that you'd like to share with people when you talk to them about sickle cell?
There's some really great websites. I'd be more than happy to email you.
Okay.
Happy to do that. It often just depends too on what the concern is, or whether they're interested in learning more about sickle cell, whether they're interested. I mean, there are some really great resources out there for just understanding the emotional challenges of living with a chronic health condition. So yeah.
Okay. Yeah, absolutely. I think that would be fantastic. And then I will share those on my website or in the show notes for this episode.
Okay.
Yeah. And if you have any book suggestions as well, I know we talked about that a little bit earlier. You can share those with me later, and I can put those on the website. I think that would also be excellent.
Yeah. So as you know, I'm very passionate about reading. So we know that patients with sickle cell are just at a little bit of a higher risk to experience academic difficulties. And that is related both to the disease itself. So we know that individuals with sickle cell are at risk for both silent and overt strokes, which then affects the brain structure, attention, learning, things like that. And so it's really important that we encourage our kids to read. So I have developed a program here that gets a book in the hands of every child when they come to our sickle cell clinic, because we think reading is super important. And
That's excellent.
Yeah, and the books that we provide them with have characters that look like our families. So we know that at least in our clinic, about 95% of our families identify as Black or African. So we've selected books that have Black protagonists, because we know that relatability helps with reading. If you can read a story and you can see yourself in the characters, you're more likely to continue reading it.
Yeah, absolutely. I think that is fantastic. And tell us where you're at again.
Yeah, so that program is called the Sickle Cell Story Club, and it is based out of Riley Hospital for Children in Indianapolis.
Great. Yeah, I think that is amazing. I think that children pick up so much from books. And we also know that early exposure to reading, really can expand your world. It can help with how you're doing in school and just what you understand about the world around you. So I think that is an excellent way to get books to kids, and to just encourage that love of learning. And then again, being able to see yourself in the book oftentimes makes it more relatable, makes some of the situations, more engaging in a way. So I think that that's really important, and I'm glad that you're doing that. Yeah. Is there a way that readers can find a book list from those books that you're sharing? Because I'm sure that some people would be interested in that.
Sure. I'd be happy to send you, we kind of have like a Word document going, but we also have like an Amazon wish list of books that we are either interested in purchasing for our families, or if you're looking for good book ideas, there's a lot of really good books on there too. Happy to
Excellent.
send that.
Yeah. I think that sounds absolutely fantastic. Wonderful. Awesome. Well, thank you so much, Julia. We have really appreciated having you on the show. I think you have been able to share so much, a different perspective of what you do to help children who have sickle cell disease and help their families as well. And I think you've given us a lot to think about here, and we look forward to getting all these resources. I'm very excited to see some of the books on this list.
Yeah, absolutely.
Absolutely. Yeah, thank you so much.
Thank you for having me.